Distinguished ministers, thank you for the opportunity to speak with you today. I will be brief. 1 year ago at Davos, I and several other public health leaders tried to raise the alarm about the events unfolding in China. I said then, this is not China's problem, this is the world's problem. On January 23rd, when there were fewer than 600 confirmed cases of COVID in the world, CEPI announced its first 3 vaccine development partnerships, including one with Moderna. The next day, in an interview, I said, in 20 years of working on epidemic preparedness, I can't say that I've been more concerned than I am about the current virus. On February 27th last year, CEPI highlighted the need for at-risk investments in manufacturing so that we would not face acute shortages when vaccines became available. These were not forthcoming, and now we are experiencing the stuttering supply that we predicted. In March, we called for the creation of a globally fair allocation system for COVID-19 vaccines. This fed into and helped spur the creation of the Accelerator and COVAX. We have accomplished much in 1 short year. The world now has a number of vaccines from Pfizer, Moderna, AstraZeneca, Sinopharm, Sinovac, and others that have demonstrated their efficacy, and in conjunction with diagnostics, therapeutics, and social distancing measures, offer a potential way out of the pandemic. But we face many challenges. The virus has mutated. The new variants first observed in the United Kingdom, South Africa, and Brazil spread more rapidly than the virus we fought throughout 2020. The UK variant may be associated with a higher case fatality rate. The variants identified in South Africa and Brazil are even more frightening. They spread rapidly. They can reinfect people who have been infected before, and they may render our countermeasures, including our vaccines, substantially less effective or useless. Last night, we received the results of another vaccine from Novavax, which demonstrated an effectiveness of almost 90%, including against the UK variant. It was also tested in South Africa and is the first vaccine to go head-to-head against the South African variant. It demonstrated at best 60% effectiveness, and 1/3 of the cases that emerged in the trial were in people who were known to have been previously infected with the old virus. These were cases of reinfection. Of all the vaccines tested worldwide over the last year, the Novavax vaccine had demonstrated the highest levels of binding and neutralizing antibodies, higher than Pfizer, higher than Moderna, higher than AstraZeneca. In the last 2 hours, Johnson & Johnson has just reported the results of their trial in South Africa with their vaccine. Their effectiveness was 57%. Distinguished ministers, ladies and gentlemen, we are on the cusp of seeing all of our gains of the last year undone. As long as the virus is circulating anywhere, and the more it is circulating, the more and faster it will mutate. Our only hope of getting ahead of the virus is controlling its circulation globally. And our only hope of doing that is if the diagnostics, therapeutics, and vaccines we have developed are shared globally as a matter of the greatest urgency. I implore you to fully fund the full research and development, procurement, and delivery needs of the Accelerator immediately, or we are at risk of going back to the beginning.
Probably just to first thank all the ministers present in this room on behalf of the ACT-A partners for the great support and for the reassuring words on pursuing a multilateral solution. I wanted to comment particularly on the implementation of COVAX. Gavi with its co-lead CEPI and WHO are indeed, thanks to the early funding provided from your capitals, has indeed secured at least 2 billion doses and at least 1.3 for low and middle income countries. So implementation is now starting with us communicating to countries the doses that they will be receiving from this quarter and some as early as this month. Again, as we have heard today, the important thing is really to be able to continue on this trajectory. We heard from Richard talking about the need to continue investing and the other pillars. So implementation has started. I want to reassure you on this, and there's a need to continue together through this multilateral approach.
I'm speaking both as a co-convener alongside FIND of the diagnostics pillar of the ACT Accelerator and as a co-convener of the Health Systems Connector, which is the fourth pillar of the ACT Accelerator alongside the World Bank and WHO. On diagnostics, the success has been the very rapid development of effective tests. Within 3 months of the genome being shared, there were molecular tests known as PCR tests, and within 6 months, we had high-performing rapid diagnostic tests known as RDTs. However, we have not done so well as a world in ensuring equitable deployment of such tests, and thus in supporting countries across the world in implementing effective test, trace, and isolate strategies to contain the pandemic. Although we, through the ACT Accelerator, have provided 45 million tests during the course of 2020, this is, to be blunt, a drop in the bucket. Low and middle income countries are currently testing at about 15% of the rate per 100,000 people per day that we are currently seeing in high income countries. In many of the lowest income countries and communities, we are effectively flying blind. We do not know what's going on with the pandemic. Looking forward, we must continue to drive innovation in test performance, in self-testing, in ease of use, such as nasal tests, and in price. And indeed, partners of the ACT Accelerator, Unitate and FIND, have just announced a package which will take the RDT cost down to $2.50. But most importantly, we must massively scale up the volume of tests being provided to the lowest low and middle income countries in the world. This is vital to containing transmission, which, as Richard just underscored, is absolutely vital to containing the overall threat to the world. We have targeted that we need to be able to provide at least 900 million tests through the ACT Accelerator. This is still a conservative number. It assumes that low and middle income countries get to 1/3 of the testing rate of the high income countries and that they pay for half of that themselves. The emergence of variants underscores the imperative of building better surveillance across the world. Richard pointed out the significance of the various variants, but at the moment, we are finding those where we are looking, not necessarily where they are occurring. We need to have more lab capacity, molecular testing, gene sequencing across the world so we can identify these early, because time when we find one is of the essence to enable us to adapt our vaccines, our diagnostics and therapeutics. So given this, we have actually in the most recent revision of the ACT Accelerator budget increased the number for diagnostics to over 8 billion. On the Health Systems Connector, the Health Systems Connector is designed to address implementation blockages and challenges in countries to using the tools developed by the vaccine, diagnostics, and therapeutics pillars. And there are a number of different work streams. I won't go into detail given time, but I just want to highlight 3 areas of particular importance. First of all, it is absolutely vital that we protect frontline health workers. Most of the poorer countries in the world start with a lower ratio of frontline health workers to their general population than the richer countries. If we start losing more of them, and many countries are, including South Africa, sadly, the health system is unable both to respond directly to COVID-19, but also to mitigate the impact on other diseases, whether HIV, TB, malaria, maternal health problems, and so on. Frontline health workers also, if they're not protected, become vectors of transmission. So PPE is we need to provide high quality PPE at much greater scale across the frontline health workers in poor and middle income countries. Secondly, oxygen. Philippe will talk about the prospects and where we've got to on therapeutics, but one of the most powerful tools we have to stop people dying is providing oxygen support to the most severe cases. This is extremely limited in its provision across most of the low and middle income world. We've put in the Act A budget about 1.2 billion for increased supply of oxygen. This is one of the most powerful, simple ways, proven ways in which we can save a very large number of lives this year. And finally, on the health systems connector, I do want to draw attention to a massive amount of work going on, led by the World Bank and WHO, to do readiness assessments for vaccine deployment. 114 countries have completed theirs already, and these are being used as the starting point for detailed deployment planning. So the Health Systems Connector works in conjunction with the three product pillars to ensure that these products, vaccines, diagnostics, and therapeutics, can be effectively deployed. So as Richard said, this is a moment for us to step up collectively. We're not actually winning this fight against this pandemic as effectively as we need to. We need to crush transmission rates because they drive mutation rates. And the more we let the virus mutate, the more difficult it is to fight. So as he said, we are really looking for your support at this point to fully fund the ACT Accelerator. Thank you.
Just to reinforce the message of my colleagues, Richard and Peter, just to highlight a couple of things from the therapeutic perspective. First, we need to be absolutely clear that we need all the tools together if you want to be ahead of the virus, and we don't are in that situation so far. And again, we need to have access to safe and effective therapeutics this year, in addition to what was described in terms of needs for vaccination and diagnostic. And of course, we need to focus on LMICs because equitable access is a key success factor for the fight. As mentioned by Richard and Peter, the emergence of the new variant has not only an impact on the increased number of cases and transmission, but also affect the efficacy not only of the vaccine, but some of the progress that we have seen in the therapeutics, for example, for monoclonal antibody. For existing tool, the point of Peter, such as medical oxygen and dexamethasone, the uptake is quite low in the LMICs. And really, we need to get better organized to support the country in transforming the demand into implementable project and make sure that we have the funding who can back this. So the 1.2 billion for access to oxygen is absolutely critical. I just want to reinforce the point already made by Peter. So again, what we need to look at for the coming weeks and months is, given the situation, we need to invest more in new tools, making sure that we can address and stay and be ahead of the curve from the virus mutation. So again, there are a lot of things that needs to be done, and we have a plan for that to make sure that we can counter that and fight the virus, but also to give a more specific response for the immunologic disorders. So the second point is to make sure that at the same time, without losing time, we have the capacity to scale up any tools that will come available and make sure that we have access in terms of production, in terms of delivery for the tools that are existing, oxygen, corticoid, and immunoregulator. And then I think that's one point, which is the point of health system, but it's also to make sure that the country has the guidance, but also the support to make sure that any tools that are available are effectively used. So country support will be key for many LMICs in the coming weeks and months. So that's the priority we have. Working, of course, I'm talking on behalf of the therapeutic accelerator with, of course, the Wellcome Trust, but also Gates Foundation, WHO, Global Fund, and UNICEF. And I think that we can, of course, do a lot, but we need actually your support. Thank you.